Thank you, Chair Simpson. It's a pleasure to be here this morning with you all. And so I'm going to do a presentation today just to talk about our COVID-19 vaccine distribution. It started in mid-December is when we got our first doses of vaccine into Lake County. And so we've been working very diligently, assuring that the phase 1A population, which is healthcare workers, has been vaccinated. And we did move into phase 1B last Monday. So I'll be talking about both of those as I go through the presentation. So on the first slide, I just wanted to make sure that we were all understanding the, go back one slide, please. Oops. Okay, that on the first, go one slide up, is on this first slide is really the population of Lake County that is greater than 16 years and older. And the Lake County population is 696,535 people, 2019. The Lake population 16 years and older is 552,000 individuals that are that age and older. And just as a reminder, the two vaccines we have is Pfizer, you can be vaccinated if you're 16 years of age or older. The Moderna vaccine, you can receive the vaccine if you're 18 years of age and older. But to really talk about the magnitude of this issue that we have at hand is to try and vaccinate 80% of our population. That pretty much equals to almost the same population as 16 years and older of 560,000 people. And because our vaccines that we have, both are tremendous, great vaccines that have 95% efficacy, I could not be more ecstatic at the vaccines that were developed in the last year, but what has been being developed over the last decade. So just to put this into perspective, is both vaccines require 2 doses. So if you think about 560,000 people needing to be vaccinated to reach that herd immunity, that is 1.12 million doses. So in order to vaccinate all these individuals in 6 months, that's going to require us to vaccinate 186,000 doses per month. And then when we translate that to a week, that's 43,000 doses of vaccine that we're going to need per week. And that is 6,137 doses per day. And so I'm going to put on my Professor Main hat a little bit and just let that sink in. 43,000 doses per week. So we started this campaign back in December that the Lake County Health Department has received to date 41,000 doses total. So let that sink in a little bit. So just to put this situation into perspective, it's going to take 43,000 doses per week. And in 6 weeks, we've only received 41,000 doses. So we'll move on to the next slide. So I really liked what DuPage County did, and they came up with this concept of what to expect on your vaccination journey. And I really want to make sure that everybody on this call understands the vaccination journey for our residents and for yourself when it becomes your time. So step one is that we pushed out in early December. As you remember, we wanted everybody to go visit the allvax.lakecohealth.org site to start their journey by registering. And then once they registered is then based on the answers to the questions that they put in, is then we were able to then later notify them when their eligibility came up and we had vaccine and they could schedule an appointment. So they could schedule an appointment through us at our mass vaccination site. And recently, what is now coming out is that we have more community-based providers, so people can sign up directly, through a Walgreens or, well, not Walgreens yet, but through a Jewel Osco or Mariano's. And so there are providers that are coming online now that people can sign up for, or they may be receiving a phone call from their hospital system, and then there's getting an appointment scheduled. So step 2 really comes down to individuals will be prioritized based on the CDC and IDPH criteria, which I'll go through later. So I won't spend a lot of time on that now. But then the Lake County Health Department through AllVax or through other community providers would either email, text, or call registrants when COVID-19 appointments became available. As you're aware, that AllVax has also been sending out various updates to keep residents informed while they wait, or to go back in and edit their accounts like we did yesterday, pushed out a notification to, all frontline essential workers to go back in and edit their accounts. So then step 3 is when residents will be notified by AllVax or a community-based provider that they can schedule an appointment based on eligibility and vaccine supply. Or again, there are opportunities now in Lake County for people to schedule directly at a pharmacy or other provider. Next slide. So step 4 is on their appointment date, whether it's at our mass vaccination clinic out at Grays Lake or at a hospital or at a pharmacy, individuals show up at that vaccination site and they get their first vaccine dose. Then step 5 is, because this is a 2-dose, is that the individuals need to make an appointment after 21 days for Pfizer or 28 days for Moderna for their second vaccine dose. And just as a reminder, those are the minimums. Those are not the maximums. We have a lot of the public that's very concerned that if they don't get their vaccination on that 21st day, that it's bad, or on that 28th day. They have 6 weeks to get their second dose after that 21 days or 28 days. That's a minimum, not a maximum. So if they make an appointment on 23 days, that's fine. If they make it on 35 days for Pfizer, that's fine. So they have an opportunity. And then I can tell you that every provider is attempting to assure that people either A, after their first appointment, that they can schedule a second appointment immediately, or that entity is reserving conceptually and planning, doses for those second doses. But again, these are minimums. They are not maximums. So they have 6 weeks after their 21 days or 28 days, according to CDC. Next slide. So as a reminder, the Lake County Health Department does not generate the prioritization groups. Those are completed by the Centers for Disease Control and Prevention based on recommendations from the Advisory Committee on Immunization Practices, and that's ACIP. Then the Illinois Department of Public Health reviews those, and then they say, yes, we're going to follow those. And as you know, one of the things that the governor did in the state of Illinois is originally ACIP said that for phase 1B, that it was going to be for those individuals 75 and above. But the governor of the state of Illinois actually changed that to 65 and above, which increased the number of individuals in that age group that would meet the 1B classification. Next slide. So I'll just go quickly, and then I'll go into more detail. Phase 1A, that was healthcare personnel and congregate care staff and residents. Phase 1B started just last Monday. That's frontline essential workers and those age 65 and above. Phase 1C is those persons age 16 to 64 with medical conditions that increase the risk for severe COVID-19. One thing I want to say here, this is not a list of all medical conditions. These are medical conditions that the CDC has correlated strongly with increased risk for severe COVID-19. So we've had a lot of the public saying, why is my X medical condition not on there? Because their X medical condition is not correlated with an increased risk for severe COVID-19 and other essential workers. Phase 2 is for when we have a larger number of vaccines that are available, and that's the rest of the population. So the phase 1C and phase 2, phase 1C is still pending, and they have not completed all those individuals within that. And there has been some minimal changes to phase 1A and phase 1B of late. And so I'll just briefly talk about that. Next slide, please. So just to go through 1A. So what is the extent of phase 1A in Lake County? Our estimate was there was about 30,000 individuals that worked in healthcare personnel in Lake County. And again, we are vaccinating individuals that both live and work in Lake County, because from a public health perspective, it doesn't make sense to say to Chair Hart, well, you know, you live in Lake Bluff, but then you're working next to somebody that lives in McHenry County, and therefore we're not going to vaccinate the McHenry County person. We're going to leave them unvaccinated, but we're only going to vaccinate, you know, Chair Hart. So who was in that group? Physicians, nurses, etc. But I think, you know, just to point out that in that first group was like the emergency medical services. So those are paramedics and EMTs, as an example, were individuals that were vaccinated. Our coroner's office was vaccinated in this group, as well as morticians. You know, anyone who had direct contact with a COVID-19 patient, living or dead, or an individual that also was in indirect contact with somebody that may have COVID-19 was included in that group. And so that was estimated about greater than 30,000. Additionally, there was residents and staff in long-term care facilities and congregate care residential facilities. That's estimated to be about 13,000 individuals. Those individuals are actually being vaccinated by CVS and Walgreens through a federal program. And so there are, Chair Hart and myself and Chair Simpson were on a meeting with CVS and Walgreens last Friday, had discussions with them as to how they were rolling that out and to try and get that process sped up a little bit. They did say that everyone in a skilled nursing facility will be vaccinated with 2 doses by mid-February. They also stated that individuals that live in assisted living and independent living facilities will be vaccinated by February 14th, and that their goal was to have this fully complete by March 7th. And so in that group, there was greater than 43,000 people. Next slide. Then,
hey, Mark, really quick, there is a hand up, but I know that the presentation is a lot and some of the questions might be answered later on. So I'm going to request that we take questions after the entirety of the presentation.
Very good. Thank you. So phase 1B started last Monday. And so this is where we moved into a much, much larger group. And so you have frontline essential workers, there's first responders, those are fire and police, law enforcement, education workers, including teachers, support staff, childcare workers, manufacturing, distribution, agricultural workers, postal service workers, correction workers, incarcerated people, public transit, grocery store, etc. And so some of the ones that I wanted to point out for you is that, for example, starting tomorrow, and then we're going to have Round Lake High School will be what we call a closed point of dispensing for all pre-K through 12 private and public school staff will start being vaccinated out at the Round Lake High School. This is a joint partnership between the Lake County Health Department and these all 45 school districts throughout Lake County and private schools. And then on Friday, that there will be another pod opening up at Stevenson High School. And so we will be this week alone having about 2,100 staff be vaccinated at those 2 locations. Also, under the manufacturing is that we have started providing vaccine to AbbVie and Abbott. So they will start working with their manufacturing staff. And so they're vaccinating 65 and above staff first. And then they're also making sure that they're vaccinating individuals that are in the manufacturing line that are from the most impacted communities in Lake County to COVID-19. And we also will start pushing out additional vaccine to like Mariano's, not only for those individuals coming in to their locations, but also to grocery store workers would be starting to be vaccinated there. And then all of the hospitals are totally concentrating right now on 65 and above. So that is a major push for 65 and above. And so those 2 groups equal approximately 203,327 individuals. All residents age 65 and above is estimated by the census at 103,000. And I can tell you that over 50,000 residents in that age group have already registered in Allvax. Next slide, please. Then we get into phase 1C. All these definitions are still pending, again, the one comes down to different conditions that may be at increased risk for severe COVID-19, and then a whole host of other essential workers, but that's going to be in the hundreds of thousands of people also. Next slide. So what does that look like from a phased approach in a calendar? Is that we're expecting that, the phase 1A, we still have a few more people. Our goal was to complete that December through January, but there's been additions of different individuals that have fallen into that phase 1A, and we're still picking up the dentists and other non-affiliated physical therapists. In fact, we're going to be moving the school nurses to our other pods to make sure that we have more room for finishing up phase 1A. We're hoping to be done with phase 1A in Lake County in the next 2 weeks at our mass vaccination clinic. But that, again, we will be blending phases as we move forward. Phase 1B, again, that started last week. We think that'll go from February through April if we have the supply of vaccine and the vaccinators to do it. And then phase 1C, if all goes well, potentially starting in May through June, again, depending on vaccinators and vaccine supply. And then phase 2 starting in July. And maybe by July 2, we may have a vaccine that's approved for use for children. Those phase 3 trials are ongoing at this point in time. So that's the estimated population and vaccination timeline. Next slide. So what we're going to be seeing is transition between groups. And I can tell you that some of our residents are not happy about this. They want a very black and white, clear-cut division. Unfortunately, with more people being added into the phase 1A, with those changes, more people being potentially moving into phase 1B from 1C, is that we're going to see this transition, this blending between the different phases as we move forward. So there's not going to be a clear delineation and transition between groups. Next slide. So what is our role as the Lake County Health Department? I mean, ultimately, our role is really to be an air traffic control person. We want to make sure that vaccine is being allocated across Lake County. In the beginning, we were doing a lot more vaccination. As time goes on, their other providers are going to be coming in and doing more vaccination. We will be doing more redistribution and allocating vaccine across the different providers. The other thing that we've been working on very diligently is to get more and more providers into the eye care system, because we cannot provide any vaccine to a provider unless they are approved by the state of Illinois. And I'll go into that a little bit about what they have to agree to become an eye care provider. We also have been communicating to the community about where to access vaccines. There is now a larger list. There was a dearth of providers in Lake County in the beginning. I will speak to that, but it has now grown to over 60 in Lake County, which is good news. And we're hoping that will continue to grow rapidly, as well as the supply of vaccine. And then we've obviously led our own mass vaccination site out at the fairgrounds. And then we're also leading and partnering with mass vaccination clinics like the one I just discussed out at the Round Lake and Stevenson High School. Next slide. So where will I get my vaccine? And just as a reminder is that the Lake County Health Department receives direct allocations from the feds straight to us. And so that comes in the form Moderna and Pfizer. It comes frozen to us. We then take that vaccine, we put it in our ultra cold freezer, and then we also put it in the regular freezer for the Moderna. IDPH is also allocating some doses to Lake County, or is expected to, as they ramp up pharmacy response. So IDPH is going to be allocating doses to Lake County, and will go potentially direct to those pharmacies. Then what happens is Lake County Health Department, we allocate those vaccines to providers, and sometimes we do this multiple times per week. And this is an important little piece here, is that since we have the ultra cold freezer, as you remember, Pfizer, you know, once it comes out of the freezer and thaws, it has to be used within 5 days. It can only stay in the refrigerator for 5 days. So what we have worked out with the individuals that are providing the vaccine is that we actually allocate the vaccine, but we're storing the vaccine on their behalf, because then that way it gives them more time. You know, we're not providing them their full allocation at once. So let's say Lake Forest Hospital wanted 1,000 doses, but really what they wanted on one day, but really what they wanted was 2,000 doses. We'll give them 1,000 doses on one day, and then they'll come back and pick up another 1,000, because that gives them more flexibility to make sure that they're not going to waste any vaccine and assure that all that vaccine will be utilized in 5 days after they receive it from us. So then it goes to the vaccine providers, like the Lake Forest example I just gave you. And then next slide. But before any of these entities can get this vaccine, is that A, the healthcare providers, they have to be able to vaccinate per their scope of practice. They have to be licensed. There has to be medical oversight and direction of the vaccination. You can't just provide vaccine to anybody. You know, these are individuals that have to be licensed and approved to, whether it's a pharmacist or a paramedic. I mean, these are all nurses. They all have to be licensed, and every one of them have to be trained specifically to provide the COVID-19 vaccines, Moderna and Pfizer. Pfizer has a different methodology than Moderna. So you have to mix the Pfizer with a diluent. There is no mixing with a diluent for the Moderna. So everybody has to be trained into how to appropriately vaccinate individuals with these two vaccines. There has to be medical oversight at those areas. Because there are potential for some effect after vaccination. And then you have to be approved by IDPH in the eye care system. This has been a big challenge in the beginning. The state has really ramped this up. What was taking 6 to 8 weeks to get somebody approved for this is now taking 2 weeks. So they've hired a lot more people to move through on this. Additionally, they have to agree to follow prioritization, because I'm sure all of you have heard about that one person that got the vaccine that should not have had the vaccine. So all of these entities are saying that they are following the prioritization guidelines and they cannot go off of that. So they cannot start vaccinating in 1C. They could only start vaccinating in 1B last Monday. Additionally, they have to have the ability to schedule appointments and to manage the vaccine process. For anything that is jointly run with the health department, like the Round Lake, they're using the AllVac system for all those appointments, and all the managing of the vaccine process is through AllVacs. And then the vaccine, we have to make sure that the vaccine is available to allocate to the provider. This week is an example where I will have, at the end of the week, I'm going to have no Moderna in our freezer because everybody wanted Moderna. And our sites that needed it for second doses is that, so we're expecting a shipment to bring back up our Moderna, because again, everything we received gets allocated. It may be stored in our freezer for a short time, but it is being pushed out on a weekly basis and sometimes multiple times per week. Next slide. Which is really what this slide says. So as of February 1st, 21, we had 62 approved provider sites in Lake. That is brand new. That has not been the situation, and I'll go over that more in additional slides. So these are the main entities that we're providing vaccine to. Hospitals, by the way, do sometimes receive direct shipments of Moderna directly to them. All Pfizer shipments have come directly from the health department to other providers, except for the Pfizer that has gone through the federal program to CVS and Walgreens for the long-term care facilities. So who are we pushing it out to right now is outpatient providers like Oak Street Health, Erie Family, our own federally qualified health center, large employers like AbbVie and Abbott, pharmacies like Mariano's and Jewel, are the ones that we've been working with now. CVS and Walgreens do not have that ability yet in Lake County. We're hoping that by mid-February they will. And then also, our LCHD mass vaccination clinic and hospitals. Next slide. So I wanted to show you this slide is that I think there's a belief that the Lake County Health Department has received a lot of vaccine. And so while I said that up to last week we had 41,000 doses, I did want to say that because we get compared to DuPage County a lot. And so I'm using some dates where I had data from DuPage County's allocations. And so you can see in week 1, that was our first doses of Pfizer, 6825. That came in that first week. That whole first week, we pushed out every dose of vaccine to the hospitals. Second week was, every dose of vaccine was pushed out to hospitals. Third week is when we started getting, and there's 6 hospitals in Lake County. Third week, we got 1,200 more doses. And so that's where on the right side, you can see vaccine providers, is that we had 9 total vaccine providers in Lake County. So it was the Lake County Health Department, 6 hospitals, and CVS and Walgreens. So we had 9 total providers. Week 4, we got a big influx, and then we had 13,250. Week 5, 9,250, and then week 6, we actually had a little bit less in that week. And so you can see there's no rhyme or reason to the exact number of doses that are coming in. With we have been told by the federal government that they are going to start saying exactly to us that you will be receiving X amount for the next 3 weeks, so we can actually start planning better on who should be vaccinated or not. But you can see that going all the way up until January 22nd, when Oak Street came on board, is that we then had 10 vaccine providers throughout all Lake County that were approved to receive and vaccinate with COVID-19. So if you could just flip to the next slide. And so here's some current distribution progress by select counties. So the reason why I wanted to just show you those numbers up to 123 is for what DuPage County presented to their county board last week, is that Lake County has administered 38,668 vaccines. Now, don't forget the federal and the direct ships to the hospitals are also in that number. But the Lake County Health Department received 35,925 doses that we allocated, whereas in that same time period, DuPage County Health Department received 93,875. And I can already read your brains. Why did DuPage get more? And so the reason why was because the original allocations through January were based on the number of healthcare workers that were expected to be vaccinated in that county. Once we moved into phase 1B, we're expecting to see more doses starting to come to Lake County because we've moved from a healthcare worker algorithm to a population-based algorithm. So this is where I want to say that, look at these first rounds of data with a bit of caution. You're going to see the number of vaccines are going to go that have been administered are going to go up dramatically in Lake County because we have more providers to vaccinate, and hopefully we're going to have more vaccine to redistribute to those providers. So at this point, Lake County has 1.3% of the population fully vaccinated, whereas DuPage has 2.15%. McHenry is right in tow with us, and then Cook County is at 1.7%, but then they have 2.4 million people. A lot of vaccines are going to be needed for Cook County. So at this point, while we are lower than other counties, it is by no means that our teams and our partners are not working diligently and hard. It is multifaceted is that we are also only getting credit for individuals that zip codes that have been vaccinated in Lake County are being counted towards our proportion, because it's only counting individuals that are residents of Lake County in these statistics. Whereas we do know that we have vaccinated, including our staff here at the health department, that are healthcare workers that do not live in Lake County. They live in Cook County or potentially Wisconsin or other counties. So those other counties got credit, for those immunizations that were done here. However, City of Chicago has also done this analysis in their world that about 25% of their doses have been provided to people that live outside the city of Chicago. So I just wanted to point that out, is that the public health imperative is whoever we can vaccinate, we want to have vaccinated. And we do know, and actually one of the members here, her husband actually got vaccinated in Cook County. And so he got counted for Lake County, but we did not provide the vaccine in Cook County because he's a healthcare worker. Next slide, please. All right, so that's one of the things with regard to where we're at now, and we are expecting to expand. But I just wanted to put this slide up is just as a reminder to kind of transition into everything I just talked about means that everybody wants the vaccine. And that is not necessarily accurate. So how to get to herd immunity. So as you remember, back in May 2020, for every age-adjusted, is that for every white case, we had about 4 Black African-American cases, and we had 8 Latinx cases. So we definitely had more of an impact in Waukegan, North Chicago, Round Lake, more impact. As more testing came out, is that those ratios actually dropped. So there was more testing. And then what we found that there was more individuals, Caucasian, non-Latinx, that were actually positive. So now those ratios were 1, 1.8, and 4.25. However, the next slide, please, really gets at one of the things that we're finding is that while we had the greatest impact to our communities in areas of color, what we are finding is that there's a lot of vaccine hesitancy in those same areas. So we as a county health department have created what we call the community health ambassadors. And we now have over 100 community health ambassadors that are working with trusted community-based organizations, with trusted faith-based individuals to really get out the information about the benefits and risks of these 2 vaccines. We've done trainings, we've gone through this with them. And so just click the next button. And so what each community health ambassador receives is optional training sessions. We've had multiple training sessions to go through the different vaccines, how to talk about it to people, not shame people for not getting the vaccine, not create fear that if you don't get the vaccine, that grandma's going to be harmed because of what you're doing. It's really talking about the facts about how the benefits of these vaccines far outweigh the risks. And so we've created answers to FAQs, provided promotional materials, and then certainly we're providing recognition for those that are really getting out there, talking to their communities, and really promoting the message that these vaccines are going to allow us to get our lives back, and they're there to really make sure that what we used to love and do, this is one major tool to get back to that location. And so that's something I wanted to put up at the end, is that this is huge, that we need to make sure that people are not posting poor information out there about the vaccines and different aspects that I don't want to actually mention today, because they say every time that we mention, some of the falsehoods, that just promotes those falsehoods. So, there's a lot of terrible things out there on social media that are totally untrue. And so we need to make sure that we're promoting the true facts with regard to these 2 vaccines. And that is the end of my presentation. So I'll be happy to take questions.